This video will document the unusual case of endonasal endoscopic resection of bilateral lateral sphenoid encephaloceles in a woman with elevated BMI and cerebrospinal fluid leak. First, vascularized nasoseptal flaps are harvested bilaterally. The sphenoid sinus is opened widely from ostium to ostium. The maxillary sinuses are opened bilaterally after performing antrostomies because this operation will require bilateral transpterygoid approaches in order to reach the lateral sphenoid recess on both sides. Here the maxillary sinus is being opened. First, attention is turned to the left side where a transpterygoid approach is performed. The angled 30-degree scope is held on a scope holder along with angled instruments. The pterygoid wedge is drilled out, revealing the encephalocele lateral to the sphenoid sinus. Further drilling of the bone inferiorly exposes the defect. An inlay of DuraGuard is used, covered by fat and a vascularized nasoseptal flap. Attention is then turned to the right side. The inferior lateral wall and transpterygoid approach are performed on the right to expose the right-sided lateral sphenoid encephalocele after drilling out the back wall of the pterygopalatine fossa and pterygoid bone. The encephalocele is resected. The defect is identified, and the margins are cauterized in order to expose the exact and precise limits of the defect in the bone and dura. Here we use, again, a 30-degree scope as well as angled instruments to remove the last remnants of the encephalocele and define the margins of the defect. Again, an inlay of DuraGuard is first performed, and this is covered with autologous fat and then covered with a second vascularized nasoseptal flap, which are placed across from each other to cover both defects. The closure is then covered with adherus, flow seal, and nasopore, and the post-op scan reveals both defects have been closed.